So the shared decision-making model is the concept that patients are actively involved in the decision-making process about what types of treatment they're going to get. And because the patients are the only ones who really can experience both the risks and the benefits of the treatment choices that they have, it's a critical aspect. And I think the other part that's really sort of lost in this piece is that it really is shared. It's not about the patients having to make those decisions by themselves. It really means that the physicians, the nurses, the care coordinators, and the patients together help understand what the options are, what the preferences of the patients are, and making sure that those two are the same. So the aha moment for me is how long things take to change. But having said that, I am a very optimistic person. And for me, the aha moment that's coming about now is that more and more physicians, as patients, are really understanding about the power of shared decision making. So we think of ourselves as an authority. You know, people are coming to us for our advice. But we also have to recognize that, you know, almost every physician is a patient too. And so as a physician, when I'm actively engaged with my primary care provider, I want them not to tell me what to do, but I want them to help me make decisions that are appropriate for me, which means actively engaged in shared decision making. And here, instead of the person who's proposing and pushing the idea about shared decision making, I'm the one who's asking for it. And for me, that is a really important piece that's happened most recently, I think, is more and more physicians recognize that that's actually okay. It's not a weakness, it's actually a strength to participate in decision making with your patients. Patients are people, and it's really important for people to know that it's okay to ask questions, that you shouldn't always feel like you're there to listen. And participating, really being an active participant and really driving that discussion, with your provider is really important. And it's a shift for many people. It's really hard for them to do that, but it's really important if you're going to get the care you really want. And I think here you will find that your physicians and care providers are going to be much more open for that questions from you as well. And I think that's really good for you. It's a great saying about how strong Intermountain Healthcare is from that standpoint. Our mission really is to support providers, that's hospitals and physicians, as they move from fee-for-service into value-based reimbursement. And we do that through a variety of data management and analytics. We have applications for care coordinators and physicians and administrators so they can understand how they're doing under these new payment models. And then next year we'll be explicitly incorporating shared decision making as part of that as well. So we're trying to get everybody on the same page. And it's a very exciting time in healthcare right now. I feel very honored to be participating in this, what I think is a real sea change.